So I'm Sriyani Padmalata. Uh, so today I discuss with you neglected tropical disease in middle income countries. Actually, I'm going to discuss with you complex intervention and evaluation process and how it managed by ourselves as a healthcare workers. So first of all, I would like to. Oh, I can't move my screen. Yes. First of all, I would like to introduce a little bit myself. I'm registered nurse, former and midwife, and also the nursing practitioner in Sri Lanka. And I work in the clinical sector more than 20 years of in the Sri Lanka and 5 years now in Taiwan. And also, I'm a strategic committee members of development of the public health nurses in Sri Lanka because today topic more important for the public health. That's why I mentioned how I entered to the healthcare system in Ministry of Health in Sri Lanka. And I'm also the lecturer at IIHS and Defence University in Sri Lanka and also the Colombo University in First Nursing Faculty and until now. And currently, I work as a postdoctoral research fellow at National Cheng Kung University. So I graduated from National Cheng Kung University. My advisor is Professor Monica Ko, and my majority in my PhD is the systematic review, meta-analysis, meta-regression, and also the quality of life. Today, lectures so important for us to maintain our quality of life and also psychological status, breast cancer, and vaccination, and COVID-19. Last year, we have huge crisis of COVID-19. And I did my master's in ACI University. It's related to health economic, cost analysis, health policy. Actually, it's kind of international health system, how we maintain. Today lecture also very important for the health system. And I do my bachelor's in Malaysia as well. I'm a specialized critical care nurse in Sri Lanka and first nurse practitioner in Sri Lankan context. And I do the health information and health technology. Basically, I graduated from the diploma in nursing as basically my education, but after that, I followed three area. And also, I would like to introduce a little bit about my international professional partnership. I'm the member of ICN Leadership Policy Institute, and also I'm a member of the ICN Advanced Nurse Practitioner Network Group for 2002 to until now. And I also the member of the International Society of Telemedicine and eHealth since 2019. Last year, I received the International Ambassador of American Association of Nurse Practitioners. Since then, I'm the International Ambassador of Sri Lanka as a Nurse Practitioner Association. Actually, I came from the Colombo. This is my hometown, and I came from Sri Lanka, especially in the capital, and there where I'm located. My area, and this is our country flag and some state sign for your knowing about me, because everyone, Indonesia and Sri Lanka is kind of the tropical country. You want to know about me, why I'm here, and what is the important to me, this lecture, and how we are persuade those kind of problem in current happening in our health system. So that's why I'm going to introduce by myself. So before I go to my lecture, I want to little bit introduce about Sri Lanka in little bit detail, because Sri Lanka is the 25 districts and is the island, and not like Indonesia. I think it's same to one island of Indonesia because it's a small country. Our capital, our total population is nearly 22 million, and we are also multi-ethnic group country. We have Sinhalese, Muslim, Tamil, those kind of population, and also we are tropical area. Okay, so, and I work in the National Hospital of Sri Lanka. It's the main healthcare deliver center in Sri Lanka. That's why I want to show you this picture. This is my hospital where I work in Sri Lanka. And before I start to this lecture, I want to know about why this month is very specific for my topic. Anyone know, those who know, please put in the chat box why this month is so specific for today lectures. I am happy to take some answer from you all, guys. Please put in the chat box. I will give 2 minutes. Anyone know? How can I see the participants? Do you have any idea why this month is so specific?
Actually, am I again?
Yes, yes, Henny.
Okay. Actually I don't have any idea, but maybe because currently maybe in Sri Lanka, also in Indonesia, have the weather related to this kind of issue. I mean, like for the tropical disease, because currently our weather is very unpredictable. For example, like there are hard rain, and then suddenly there's very hard wind or something. If I'm not mistaken. I don't know
Yes,
what is
yes,
happening.
it's part of. Thank you, Henny. Actually, I think I should go ahead. Maybe anyone don't concern about. Actually, this month is the World Tropical Day month, and this month we call is the Tropical Month, and the January 30 is the World Tropical Disease Day. It's very important for this month for us. This picture where I'm taking from the WHO website, and you can go more in detail to WHO website. There's a lot of information in content about the tropical disease, and also that today is this month is very special for tropical disease. What we Henny told, this is weather is so much unpredictable, and many environmental and society changes happen in January. So therefore they introduced the new day for celebrate the World Tropical Disease, Neglected Tropical Disease Day in January 30. So that's why this month is very important. So I think this lecture is also very important because it's the real matching with the WHO theme, how they are introduced. Okay, so then, I think everyone know what are the tropical countries, because this disease then introduced because those diseases come from the tropical area in the around the world. You can see the red color is the tropical countries in my pictures. So actually tropical country in Sri Lanka also part of tropical country, and Indonesia, almost every island belongs to the tropical area. So this area has a specific climate changes and specific weather changes, and also the population characteristics very diverse, and their lifestyle and their behavior and their uh, cultural attachment, all those things are so much diverse, and it's become to the tropical disease, and it become tropical country, and those are become a tropical disease. And you can see this red color area is the most tropical country, and some area of dry climate. But tropical disease is not because of the dry climate. It's kind of the geographical area of your country mostly influence. The Why we are talking about the neglected tropical disease? Because they have this kind of disease, we are categorized 20 disease, and mainly those are preventable. That's the most important, and it improves the community because it's happening because of our climate. So it's mean this is can because of our community problem, and also the it's really effect for the woman and children, and also the is cause our total health and social. Not only that, it also influence to our economic consequency. You know, in Sri Lanka or Indonesia, we are in low middle income country. So actually this topic also it has talking about our economic status, and if you have the NTD, it means your economy will be more much more worstly. So, and most of these diseases are, many of them are vector borne. It means it come from another source to your body, and sometimes it developed from another source and it came to your body. It's kind of the vector borne diseases, and also most of the time they are live in the animal bodies and they come back to the circle, the very diverse circle to human body. That's we call this disease can be preventable, because if we can remove the source, we can maintain the disease spread. Those kind of disease, those kind of uniqueness it has. So let's see what are these 20 diseases. These are like Brurari ulcer, change disease, dengue and chikungunya, rabies, and also the snake bite. I'm not going to in detail talking about this all 20 diseases, but just we go through the little bit briefly. So Brurari ulcer most probably is microbial. Skin infections cause the several destruction of your skin, bone, and tissues. It's most probably in based on your skin disease. And Chagas disease, also life-threatening protozoan illness transmitters disease in human contact, is also the vector in status, and just like a bug's bite and bugs comes and those kind of things. And congenital transmission also, it tells, especially infected food or the other mix up contaminated food, it will be worse. And dengue and chikungunya, very we all know about how is it, because in we are most terrible in the thing happened because of dengue. I think Indonesia also same, because you have many dengue cases during the weather changes time. Is mean most probably after rainy season, no? In Indonesia. So dengue is, everyone know, much more famous for us. So, and also the other disease like ductworm disease, and some diseases echinocosis, this caused by your tapeworm disease, and pathogenic sites on human organ. The egg is inside your body, and most probably dogs or other wild animal will be shared their life cycle, human to animal. So because we are much more interacted with human, so this kind of disease easily transmit to us. And foodborne disease. This kind of disease are coming from the fish, because we are in the we our country around the sea. We most of the time we eat the seafood and seashells and those kind of things contaminated parasite. It will come to your body. And also the leprosy and those kind of disease, and human Africa. Some disease not basically much more in our region, in South Asian region, including Indonesia and Sri Lanka, but some of them much more, I don't know in the Indonesia, but leprosy previously in Sri Lanka so much. But in 2019, we eradicate leprosy from Sri Lanka. This means now we don't have leprosy in Sri Lanka. Maybe Indonesia also is still ongoing to eradication program, I think. So the lymphatic parasitic, we said that elephant egg. Actually, I remember when I was in small, there are many people come with very big leg and they are so difficult to move and they take medicine, even it's not, it's uncurable. This kind of disease also in Sri Lanka, we are eradicating now, but still we are few cases happening. And mytoma, especially because of your food and is kind of the chronic disease and skin tissues and subcutaneous tissues always getting infected and it itching and your skin will be the full of fungi, bacteria, and it cause your skin so much damage, especially is in the leg because it's come from soil to leg with your bare food. And as onchocerciasis is helminth infection transmitted by infection cause severe itching your eye. Have you ever seen some people's eye almost itching and become a very redness, even though it's not look like a eye infection, but is kind of this kind of worm infection. It's really influence to your visual. Long-term death will happen because of this disease. And the rabies, we are so much pet lovers and we have much more street dogs in the around the streets, so you have to be careful and your public health team should be attention to take care of your pets, especially in the dog. The rabies come from the dogs. It means if you are vaccinated or if you got the injection for your dogs, it can be preventable. But still, rabies can't preventable around the world because human interaction with dog so much increase recently. So these are the disease and also the scabies. Scabies, is really burden for your hand and finger is itching and it's come to your it's most probably because of the vectors in stay in your skin, under your skin. The egg stay in your skin, so it's mean it's really itching your hand and it make your wound ulcer. I remember when we were in small, when I was in the primary school, many of my friends, they have their hand all has blisters of the wound. It's because of the scabies. But now Sri Lanka, we don't have scabies and we are ongoing eradication process of scabies. And cytocomies, this kind of disease, I think not in nearly to our area. The other trachoma and Yalos, those kind of all disease come from our region. And most probably I want to say that snake bite, because snake bite is not the vector-borne diseases, it's kind of the venom, is mean because of snake venom caused to our body poisoning. Actually, snake bite, maybe Indonesia, because you have many island and you have many beaches. There are two kind of snake. Those are stay in beaches and is in sea area, and the other is the wild snake. Both wild and sea snake are poisoning. Not they have highly and venom component in their body. Is mean we like Indonesia or Sri Lanka, we have to be much more careful about the snake bite. Most probably snake bite may cause so much dying in the people around our area. I think in Tunisia also same. In Sri Lanka still happening snake bite because and also our economy and our people most income area is not industrial. We are farming people. Those are going to the forest or jungle, it will be influenced to, it's quite happening, the snake bite. So those are the 20 diseases about, just briefly. I don't, if you want to in detail, you can go the WHO website and you can follow out the in detail about this disease. And also there are many of books they have written to describe about this disease. Today, I'm not going to introduce so much detail about this disease. Okay, just briefly for your knowledge to continue our lecture today. Okay, so why, the other most important things, why we saying that this disease are, why this disease are tropical disease? Because this has their uniqueness. We are calling this disease as very specific uniqueness, because this disease can make a proxy poverty of the people. Because if we are, because you can see this name also, neglected, it means actually this disease are not encountered as a like NCD, or it means the non-communicable disease, or like big infection disease like COVID or SARS, but its influence to your burden will influence to much more in development countries, especially your quality of life and your cost and your poverty, because your, it's make you a whole body deformities and income in, this is so much uncomfortable when disease come, and also it's take long time to cure. So this need high cost for long-term care, and still the treatment are underdeveloping, or there are no treatment in to happen, and it's make your socio-economic development, quality of life level are burden and worsening. That's very important. The other one is affected to population with low visibility and little politic voice. Why we are talking about little politics voice? Because it's kind of such a low income, and political can manage people. Those are living in rural area or countryside or urban area, but their economic level very low. Those kind of people are the most vulnerable population for this NTD. And also the such a people cannot readily influence to administrative or governmental decision that their health, because we are the one who need to give all the opportunity for them. They are not make their individual opinion for their health or even their food or their basic need. Those population catch up easily NTD, and their poverty level very low. You know, some like slums and like underdeveloped area, or some people live in the, they don't have house. Those kind of people are the, especially in the capital cities, you know, the slum area in capital city, most vulnerable population for the tropical disease. It means they can make some change to society, but they can't make a decision to take care of their health. Those kind of people are so attractive to this disease. And also the uh, don't travel to widely, like unlikely influenza, HIV, AIDS, or malaria. Those are, you know, tuberculosis, those kind of disease, you know, um, generally do not widely spread, and so present little threaten in the inhabited of high-income country, rather than their distribution in the restricted by climate or effect on the distribution of the vector or reservoir or most cost. Because in Sri Lanka, recently we eradicate the malaria. Now we don't have malaria, but 2 months or 3 months ago, we heard that there are some malarian cases because of the, we are near to the India, and Indian people travel to many more in Sri Lanka. So now it's happened into Sri Lanka. Some 2 or 3 cases came from the like this. And also, everyone, the last time COVID-19, one person got infected and is distributed to everywhere. So it's mean this kind of disease when you travel is me be much more influence. And also the is make your stigma discrimination, especially the girls and women. Because why? It's make your body deformity. You see the elephant leg, your leg will be much bigger. Or if you had the like scabies, your hand will be the wounded. So those kind of things is make for your life not quality. Especially girls, you have scabies or those kind of things you can't marry. And also the your if your body has some deformities or those kind of things, you can't marry and you are neglected from your society. The other thing is most influence, and it will be the abuse to your family or your near environment. Not only that, also you will be abused by yourself, because it's really burden and stressful for your own body. And also it's some of them are cause for your pregnancy, because sometimes this disease may cause to the abortion, or you are not getting the pregnancy, or abnormal childbirth will be happen after this kind of disease. And how important, most important thing is kind of the mobility and mortality. Morbidity is really severe, because it's because of the you can't work, you can't eat, or you can't to travel. Especially this happen in low middle income countries, especially in Saharan African country. Last time, most of them, I think the 95% people, young kids, they got the at least one tropical disease. So that's much of burden this disease. That's why we are need to concern about this kind of disease. These are very unique, and large body. It will be it will be cover your total body, not only your body, and also your mindset and your economy and your social environment. Everything will be make to mobility. Actually, mortality level not much more higher, but it will be sometime, especially in the dengue season. In Sri Lanka, at least 500 people will die each year because of the dengue. So in Indonesia also same, sometime the other disease also similar. And also definitely is neglected by the research. Why I'm talking this kind of disease are not going to be in detail research or survey to identify their cause and new diagnosis, also medication, because it's not a commercial trending disease, because this low society, low cultural environment, so people are not attractive to do research on this area. That's why still this kind of disease under development. And but most important things, this disease can be controllable and also preventable. Also, some countries has eliminated, and there are some lot of visibility solution for this kind of things. And WHO, they have introduced five strategic intervention in 2010, like in infected case management, vector control, provision of safe water, sanitation, hygiene, and veterinary of the public health. It will be the more advancement to maintain this NTD. And you can see how this disease can distribute their connection. You can see there are 4 very important sources to linking each other. Most probably they are in the human body. So how they are come to human body? First, they are the pathogenic source. Example, animal, it can be the files or animals extraction. So, and Medium. There are many mediums it can be. Most probably dry sanitization involving residues and also hand, face, waterborne storage. There are, especially in the unurban, underdeveloped country, where our the sanitation and our water control system in the urban area is not perfect, and always your canal will be spoiled or will be damaged. It will not clean well, those kind of things, and non-cycling nutrition also. And environment, where they are in the your soil and surface of water and also groundwater. Most of the countries in Sri Lanka also we use the ground well water. We don't have tap water. We use the ground well and take water. This water also having their pathogens, and those all come to the your food and your drinking water. So everyone need food. It's our basic need, and everyone need water. So it's also our basic need. So then food and water make a main source to your human body. That's it's come to our body. It means definitely it will come to our body through our food and drinking. Some of few of them come directly through our food. If you are not wearing the protectable shoes or protectable footwear, it will come to your body. But most probably it's come from your food and drinking water. This is the circle of them, how to come to human. Okay, so what are the key requirements to assess those kind of things? I think everyone can see this picture properly, because it's a little bit small. Hopefully you can things. This is the assessment criteria and intervention. The interventions, most probably the population and frequency, how much they can adhere to disease. And this kind of disease are natural history of infection, shortage of disease, stages of disease, and heterogeneous infection and transmission. Those are the evaluation criteria we are need to go assess on your population. Most probably, these are not much more prevalent, but frequency is very less. But we need to think how many people are infected in your area. And you need to take definitely your history, where you live, what you eat, where you travel, those kind of things. And some of them are come from the mother to family, is kind of heterogenetic influence. And actually this disease you can't measure or assess in the one time. Multiple time you need to do the intervention assessment, not only the first time, second time, or progressive. And also you need to see the prevalence and intensity of infection, especially the dengue or the malaria or rabies, those kind of disease. You need to how much infection intensity and how many population are going. And you need to assess the sampling of all ages group. It's not only for women and not only for small kids. The adults also can be. The infection can diverse to your age group. Those are the need to be assessment criteria in your population, in your society, because this is most commonly based on the public health care system. Actually, most of the public health specialties, they want to know about this kind of generic area of this disease. And the modeling projection, you need to assess the progress, and you have to tailor your intervention daily, monthly, and every year. It's continuously processed to assessment. and you need to change your healthy behavior, especially social science and social interaction, because you need to wash hand. I think nowadays hand washing is more frequently because of SARS COVID-19. Everyone going to be use hand sanitizer, but this disease can't remove by the hand sanitizer. They are resistant to the alcohol spray. You need to wash your hand properly in for this disease. And also your food need to be cooked and eat much more. You have to be washed and less eat fresh vegetable around the tropical area or unurban area, undeveloped area in people, those who are living. That's healthy behavior more important. Those criteria need to be assessed and arrange your intervention based on those important criteria. So then we need to know how to control and prevention. Actually, some of them need to the preventable chemotherapy. Most probably in some of them need preventable chemotherapy. I will let you know which kind of disease need. And intensified case management, we need to cases by cases to manage. And also the vector control, very important, is kind of public health and provision of safe water, sanitation, and your hygiene is kind of the behavioral and environmental control and veterinary public health. I start with this one is more important for the public health system in your country. And preventable chemotherapy, you can see how many of them need preventable chemotherapy. Actually, in Sri Lanka, we don't want, most probably in African country and North American country, they are using the preventable, at least one or two disease need preventable chemotherapy. Indonesia also you have some of them, but in 2015, it's kind of the eradicating process started in this disease. But you can see 1.3 billion treatment were delivered in 2020 for the preventive chemotherapy around the global. Still, 871 million individuals need preventable chemotherapy to receive their treatment, at least one disease. This is still needness and global burdening of the intervention requirement day by day. And you can see how increasement disease individual, they are how rich this in chemotherapy. In 2019, we almost reached our optimum level, and 2020 and 2021 still is under because of the COVID-19. Most of the public health specialties, including WHO, they forget to take care of the NTD because of the COVID-19. They have much more intervention or strategy for the COVID-19. So that's why these figures become a lowering, but still the needness is still demanding around the world. And vector control, because you can see the vectors, all mosquitoes, worm, bugs, and snail, everyone is the vectors. So you have to be careful by mosquito for dengue especially. And risk of the 80% of world population is at risk one or more vector-borne diseases. So it means we are all at risk for this kind of disease. But still 17% of the global burden of communicable disease is due to the vector-borne disease. So you can see still is the burdening, and mortality is 700,000 deaths occurred in the vector-borne disease. You know, dengue, malaria, rabies, and those kind of these plague. Those are how much severe for your healthcare system. It's kind of the public health burdening and worsening. We have to be careful. And you can see the global distribution, how they are needness. Actually, we are so much high numbering overlapping treatment needers. So in Indonesia and Sri Lanka. Then how we can do the effective vector control? Actually, in the 2018, we will start a sustainable development goal. They are thinking about if there's no poverty and we are the sustainable and rich society, we can control this disease. The other one is your good health, your health and well-being. The other one is the clean water. You see that it come from food and water. So it means water is very important, and your city halls and water system and also the electric system are good at in. You can control this disease. The other one is the climate action, what Henrik mentioned previously. This month is so much climate change, and around the global, these days, our climate has dramatically changed. Will not receive the rain on time, and we have much more dry season, and also our upper Dravidian area has our global warming influence. So climate action very important to control this disease, and parentingship for the goal, and it should be all together. It's kind of holistic approach. We know, we are nurses, we know about the holistic. If you can control this kind of NTD based on the holistic approach, it's kind of the whole system, not only individual, your environment, society, and also your individual thought will be effective to control. I discuss about these two category only today because there are several public health system, and those kind of things I will go in detail. And actually all this is, we need to be interacted each system. Who are the main partner to can resolve this problem? Ministry of Health. You know, this is kind of political disease because these people are vulnerable population in your community. So the public health system or Ministry of Health can do many things to reduce this kind of things. It's come from the agriculture, environment, also finance, fishery, housing, and also the legal. Those kind of ministries need to be combined with the Ministry of Health. And not only that, also the WHO, a lot of NGOs has big role to control this kind of disease, especially in NGOs, government and non-governmental organization, and research, because this disease has so much less research interesting. And also it need to be involved your civil society, administrative officers. Those are much more need to be interactive each other. And also it has a legal background, because sometimes it will influence to your legal society. So this kind of whole interaction will be come to your system to manage this kind of disease. That's why they are actually we are in low middle income country. Our Ministry of Governing system need to be much more strong to control this kind of disease. And no matter how it's hard, or no matter how is it difficult for us, but still we have milestone and some of the eradication, some of the successful story. And in 2022 World Neglected Day, they are come to concession to eradicate around the world of NTD. So that's in 2020 they have achieving much more highly goal around the world. So this is their how they do their care process and what they want to do. Eradicate totally from our society NTD in 2013. This is the milestone. In 2021 they are launching the chronic this disease, and they they are thinking about the roadmap, how to eradicate since 2021 to 2020, and they think to continuously celebrate the day of NTD in around the world, and is triggered, is kind of, they think that is kind of the need to be attention for society, but because of the COVID-19, the attention of the NTD will be less and as lowering, but they are trying to achieve in the heal of neglected disease in 2030 as in 2021. And what they do in 2020, WHO has, because we have the global pandemic of COVID-19, it's also kind of, I'm not telling the COVID-19 is the tropical disease, but it also have some influence. But we have in 2020, actually the around the world, they don't think about much for NTD, and all program become distracted, and endorse NTD roadmap and urgent members of the state. How, we are we started to talking about the NTD in 2020, published groundbreaking, and they are giving big report about the NTD, each country, and they are renew, and they started new strategy. Last 10 years is much more influence to the NTD and has bigger development. It means dramatically their development strategy for the NTD are much more success, and most of the countries around the world can be successfully eradicate the NTD. And the other important thing is these are the roadmap how we achieve this NTD. And then in 2020, they started to end in the neglected to attain the sustainable development goal roadmap and neglected tropical disease. There's a big assembly in WHO 2022. They decide to do the roadmap to eradicate the NTD around the world 2020-30. Do you think your city are ready to eradicate in Indonesia? I think Sri Lanka most of area are under covering, but now we have little economic crisis. It means it will be little bit influence to our country. But how about Indonesia? Hopefully Indonesia is high developing country. Maybe they are successful in that. And this is their goal in 2020. They think that 90% of the percentage reduction in people requiring intervention against to the NTD. They are hoping to 90% of them no need NTD intervention. They are trying to achieve. And they're trying to achieve 75% reduction in disability adjustment life year related to neglected tropical disease. They are trying to reduce 75%, and they think that they can increase their quality of life instead of the disease adjusted life expectancy. And hundred of numbers country having eliminate at least one tropical neglected disease. So in Sri Lanka last year, we eradicate leprosy, leprosy, and also the malaria. So in Indonesia also maybe some disease you have remove or eradicate. And also two number of neglected tropical disease are predicated. So this means they think that at least two diseases they will remove around the world. So those are the targets they are trying to achieve in 2030. So as a nurses or public health officers, we need to think about how we can strengthen our healthcare system to achieve this kind of goals. So this is our responsibility. Not only your government, you also have some kind of responsibility. So what are the activity plan to achieve our goals? These are the activity. First is we need to start with the community intervention, primary care intervention, and secondary care intervention. What are the community? How you can, you know, at the very first time I said that these diseases are preventable as their uniqueness. So it's because of we need to be the social mobilization, and also the preventive chemotherapy and targeted prevention, especially vector control, you know, the mosquito control and worm control, those kind of things, very important. And one health approach. So it means the health is the first priority in your body and your society and your region and your country. That's the how we can prevent this as a community level. And the primary care intervention level, how we can manage, we need to healthcare workers training and support you, supervise, and much more. It's kind of the continuous process. And also case finding and diagnosis, we need to every time we need to find the case. We try to find the case actively. Need to cases finding. We need to do the survey. We need to go home visit and clinic visit or some information distribution. How to do the how to come to clinic to test your body or get the diagnose your disease and try to find the contract diagnosis and screening, skin care and treatment, and also the rapid response, because you have flooding, you know, we are tropical countries, we have dry weather, and flooding is mean rainy weather, and also we don't have much more clean water resources. Those kind of things we need to continuously monitoring and evaluation, and also the laboratory diagnosis and treatment. So most probably the disease specific treatment itself, they are like preventable chemotherapy and wound care, like wound care, anti-helminthic drugs, or individual need their mobility care, especially in the, you see the elephant leg people, they can't walk, those kind of things. And also actually, the surgical management of this disease little bit complicated and is not the preventable, is recurrent surgical management. It happened itself for this disease. And care and rehabilitation, actually we need to support network. Each public healthcare center need to be interlinked. They each other need to be linked and sharing their information, knowledge, and counting the disease all things. And also the very important of your self behavior, because this disease, I at the beginning I told you this disease basically based on the self care management and your clean behavior, and so lifestyle very important. And also we need to do the counseling or psychological support. Definitely these people need much more counseling and psychological support and physical therapies or some others devices, supportive devices, and comorbidity and individual case identification and total system management. And we need to be management tracking system and evaluation and focus group meeting, gathering, those kind of things need to be done to eradicate this disease. And also the seminar, conference, and sharing, those things very important to management of the NTD. So it's not easy. It's this kind of the big process, and multidisciplinary teamwork need to be attended. So not in, you can't do by your health ministry, not a single responsible person. Whole administrative system is the responsible for management of NTD. So, and I saw that research area is the very limited research area. But it's not that true. There are many research area. According to individual disease, you can do the research. And also this is the big public health issue. There are plenty of public health researchers are welcome to do the research in itself, their area of a specialties or disease and we are the healthcare providers. We have a big role as a holistic care model. There's plenty of research to involve the holistic care model. The other one is the clinical trial. There are a lot of clinical trial has to be done and need to be conducted in the future. So these are the today my topic and how we are achieve those things. You have to be smart because you have to be your unique specific goal and make a productive plan to achieve this one. And you have to application, your plans need to be applied in your community and respect to each other multidisciplinary team ideas. No need to be conflict each other. And also you have to be test your hypothesis every time because time is continuously need to management this process. So that's what we can achieve this disease. And also this is the multidisciplinary team and we need one direction to prevent and control NTD. Those are the today my lecture and thank you so much giving the opportunity.
Thank you very much for Dr. Sriani. It's a very interesting topic and also great. Yeah, as your title, which is like a complex intervention for the neglected tropical disease. Yeah, I think it's very complex this one. So for the participant, now is the time for the Q&A. Is there any question from the participant to Dr. Sriani for this topic? Please raise your hand or just open your microphone. Or maybe if you want to ask in Indonesian Bahasa, it's okay. Whether you can just directly mentioning in the live or maybe in the chat. Please. Please, come on. There's no questions.
Yes, I think Dinda.
Oh, Dinda, yeah. Please, Dinda Putri, you want to ask something? Yes, please. Just directly.
Okay. Thank you for the opportunity. And firstly, I want to say thank you for Dr. Sriani for the amazing lecture today. I want to ask about something. As you said before, most of the tropical diseases come from animals. In Indonesia itself, there are so many animals that can walk around us, like street cats, which sometimes they suffer from scabies. So how you or maybe your country do to prevent the transmission of the disease that come from the animals? Thank you.
Yes, very good question. And thank you, Dinda. The question in Sri Lanka, what we did, we have street dogs. So do you think previously we did the vaccination for the dogs, all the street dogs, some public health infectors and the public health nurses, those are coming to give the injection for the dogs and sometime cats all. But it's impossible. We are not success that project. So what we did now, currently what we did, if you bite the dog or if you are touch your cat or whatever, you need to be take the rabies vaccine. That's now we give the responsibility to the people. And whenever we eat, we touch, bite, or whatever, the cat or snake or whatever, you need to do the antigen test. Those kind of tests and vaccines are free of charges in Sri Lanka, because our health system is the free of charge health system, and we give the responsibility to the human, not the animals. This is because very important to, we need to give the responsibility to human, not the animal. So it's really hard to control the animal protection. So we need to give responsibility. And whenever time we do the snake the dog bite or cat bite, so you need to bring this cat and dog with you to take the rabies, and it's the law itself. So if your dog not take care of well, so you have to penalty from the court. So those are the things that we control the rabies in Sri Lanka, and everyone has responsibility, because the behavior change very important to maintain the tropical disease. Take care of yourselves and take care of animal, also your behavior changes. So you have to take responsibility to manage this kind of disease. That's my answer, and how we control this in Sri Lanka. I would like to, I think Indonesia also has some big public health system, and public health services are important to attend.
Thank you
Thank
for
you for. Yeah, Tinda. Your question is already mentioned. Answer all. You think?
It's already clear, Miss. Thank you for
Okay.
the answer.
Is there any another question from another participant? Please, maybe one or two question more. Is there any question? Please. Oh, there is no question. Maybe can I just want to raise one question for Dr. Ziani, related to the intervention for the neglected tropical disease. How far the Sri Lanka has been implemented all of the kind of the strategy to eradicate the neglected tropical disease right now? Can you share with us?
Actually, Sri Lanka, yes, I did not include how we are preventive strategy in Sri Lanka, but we have a lot of preventive strategy, especially the eradicated disease. Still, we are good vaccination system, and we are the public health improvement so much increase. Especially we have public health in public health inspection person is PHI, PHI, and the public health nurse and midwife. They are so much need to be in-house visiting to take the not only implementers, you need to take the data and give some medicine, especially how we control the elephant plague, because we give the vaccine, and we started dot treatment for the high risk area for the elephant plague. So the the midwife or PHI need to visit each and individual house to give the oral tablet for elephant leg management. So that's how we eradicate elephant leg in Sri Lanka. The most important, we are still has much more burden of dengue. Still, we can't control dengue, even though we try to vector control so much, and we try to individual motivation, but still our public health system is not much achieved the dengue control. But the other diseases are much more respect and responsible for the public health care team. They did wonderful job. Even they have much more less resources and facilities. Even sometimes they work very far by their barefoot to see the individual house to get some treatment, to offer treatment, get information. That's how we work during past 5 years in Sri Lanka to eradicate this kind of disease. Thank you so much.
Thank you so much for the sharing to us. Okay. Is there any question from the participant? Maybe the last question. Maybe the participant from abroad, from the Malaysia, Thailand, or Philippines. You want to ask directly to Dr. Sriani, please? Raise your hand. Yeah, I think our participant has clear explanation, because I know that you deliver your presentation is so great. I guess it's already been very clearly understanding.
Thank you.
Okay, if there is no question more, so we can just finish this session in this morning for Dr. Sriani. And
Yes.
once again, thank you very much for all kind of your sharing today, and hope we can have your PPT maybe. If you would like to start with the PPT for us, you can just share to me, and then
Yes, I will send it to you.
Okay, thank you very much, Dr. Sriani. And maybe hopefully in the next or in the future collaboration, we can just have another kind of collaboration with not only for the lecture, but also maybe in the another collaboration. I hope so.
Yes, thank you so much. And thank you so much inviting me. I'm so happy to share my idea. Hopefully you can understand. If you can't understand or you need more information or things, you can contact me through Henrik or whenever. So I will share my PPT for you, and hope you enjoy with my lecture and have some knowledge. Thank you so much.
Thank you so much. And yeah, yes, the participant is the time for we will finish the first session today, and we will continue to 9:40 for the Dr. Chin Ye from Taiwan. Thank you very much for Dr. Sriani.